Hello everyone, my name is Daehan Kim. I'm a clinical kinesiologist and a strength conditioning specialist. As kinesiologists, we often work with people who are either recovering from recent injuries, had past injuries that still bother them, or are dealing with chronic conditions such as arthritis, cerebral palsy, or fibromyalgia. Each kinesiologist has a unique role that they focus on. My main role is to help people efficiently restore and maximize the movement capacity as they go through healing process or while managing any long-term conditions. As most of my clients are dealing with complex mechanical and pathological issues, I often collaborate with other practitioners such as physiotherapists, chiropractors, osteopaths, massage therapists, pain specialists, or physiatrists. I often get referrals from healthcare practitioners requesting me to teach the patients proper ways of moving and strengthening their bodies. Such referrals will never work if the patients themselves don't have the motivation to learn how to move properly. People indeed start asking how to move their body correctly. If we think about it, this is quite a peculiar trend. About 10 to 15 years ago, movement was just movement. Back then, for most people, the term movement technique was specifically reserved for sports skills. These days, people are more aware that the way they move can insidiously affect their musculoskeletal health, which in turn can affect their overall quality of their lives. People are no longer satisfied with a pathology-driven treatment if that does not fulfill their desire to move better. In addition, more and more people want to educate themselves on how to minimize their compensatory movement that are related to their chronic conditions. I think these are the reasons why kinesiology is becoming more and more recognized as an integral part of interdisciplinary healthcare. Let me give you an example of how kinesiologists can provide a long-term solution for healthy movement. A client was referred to me by her personal trainer. This client was experiencing pain in her right knee that comes and goes. Her doctor thought this pain was related to arthritis and suggested exercises. So she started to work with a personal trainer. However, she was not getting satisfactory results from the exercises and even felt more pain time to time. So the personal trainer consulted with me to find out what she can do to help her feel better. I recorded one of the personal training exercises to understand what can be improved. Let me play them for you. We can see the differences between the left and the right side in terms of how her knee is aligned. Compared to the left knee, right knee is more bowed out, which would increase stress towards the medial side of the knee. And she almost intentionally does so by putting more pressure on the lateral side than the medial side of the right foot. Posture and movement assessment showed that she tends to lean her trunk slightly to the left. She also showed decreased strength of her left hip abductor groups and the lateral trunk stabilizers. Based on these findings, we can see that she leans her trunk towards the left side, likely because she cannot produce enough force from her hip muscles that is necessary to counter the torque caused by the ground reaction force. As you can see in the picture, leaning her trunk to the left side moves her center of mass closer to the left hip joint, thereby decreasing the amount of torque on the left hip. However, habitual trunk leaning came with a cost. For example, she was already suffering from the early arthritis in the left hip, probably because of the repeated compression on the hip joint. More importantly, trunk leaning to the left side increases the amount of torque on the right leg caused by the ground reaction force, especially when she tries to transfer her weight from the left to the right side. So her body came up with another compensatory strategy. That strategy is accepting the body weight towards the lateral edge of her right foot. This can decrease the amount of the frontal plane torque on the hip and knee joints. However, such a compensation increases compression of her medial knee joint. The pain in her right knee can be related to this compensatory movement strategy. Therefore, the long-term solution should include redeveloping proper weight-bearing strategies as well as strengthening the weak muscles. The example I just talked about shows that teaching movement mechanics to the client is an important job of kinesiologists. Thanks to many workshops and educational programs, we have become quite efficient at assessing and analyzing biomechanics of movement. However, the more I work with people, the more I have realized that forcing a biomechanical principle to others' movement does not truly help people achieve a long-term adaptation towards healthy and resilient movement behavior. I have seen some cases which made me think that specific instructions on how to move actually limited their degree of freedom. When I was pursuing my graduate degrees and being involved in some of the research on biomechanics and sensorimotor neuroscience, I learned that the way that our movement is controlled is governed by complex neurological decision-making process that accommodates sensory demands rather than biomechanical logics. This explains the inherent challenge of coaching biomechanics of movement. So I eventually realized that understanding our brain's natural way of inducing motor adaptation is important to help people regain resilient movement function that is also adaptable to their dynamic environment. For this reason, I want to talk about the science behind the motor adaptation today. And I believe it is our role as kinesiologists to shape the scientific knowledge into the art of movement training. Therefore, The objective of this presentation is to build a thinking platform to combine theoretical knowledge of human motor adaptation with the currently used methods of movement training. Before we talk about the scientific theories underlying human movement adaptation, let's think about the following situation. You borrowed a friend's computer, but found that the mouse setting is different from what you are used to. It doesn't have a scroll wheel, and importantly, the mouse moves the cursor faster than you expected, making it difficult for you to control the mouse accurately. What causes the resulting error in this case? The computer? Probably not. Our incorrect prediction regarding how much the mouse cursor would move relative to our arm movement is what caused the error. However, it doesn't take a long time for our brain to adjust both our prediction and the amount of our arm movement in order to regain accurate control of the mouse. So, we can say that adaptation is the process of reshaping our prediction and movement planning in order to minimize a mismatch between our prediction and the consequences of our action. As a result of the neuroscientific research, we can now map out the brain circuit that provides mechanisms for prediction and adaptation. This circuit is often called the internal model, as the psychologist who first speculated such a mechanism said that our brain contains a small-scale model of the external reality that simulates the consequences of different actions before they occur. Let me talk about a simplified circuit of the internal model. When we intend to move, the motor cortex sends out a copy of a movement plan to other brain regions before the movement occurs. The brain regions that receive the copy of the movement plan work like predictors. One of the representative regions of the brain used for prediction is the posterior parietal cortex, which is actually a sensory cortex. The basic role of this region of the brain is to integrate various sensory information such as vision, touch, joint position change, or body equilibrium. We are able to predict upcoming sensory feedback that follows movement. That is why such prediction is called sensory prediction. When sensory prediction does not match the actual feedback, we say that there was a sensory prediction error. How is the error detected? A neural signal of sensory prediction is also delivered to other regions of the brain that are responsible for comparing predicted and actual sensory information. One of the representative regions of the brain is the cerebellum, which seems to be strategically positioned to work like a middleman between the decision-making centers of the brain and sensory receptors. Information regarding the errors in sensory prediction are fed back into the circuitry of the internal model, which allows us to calibrate our prediction or, if necessary, the motor planning itself. If you have taken the course on human motor system at Simon Fraser University, you probably have noticed that the brain map that I presented here may be overly simplified. I intentionally did so to make the content easily digestible. I would happy to talk about the details that I left out if you could email me. The theory of internal model suggested that one of the most important roles of the adaptation is to ensure our very survival. However, it seems like modern society is suffering from the cost of adaptation rather than truly enjoying the benefit of adaptation. Postural maladaptation associated with too much sitting or driving is a very common example of this. Interestingly, most people are aware of what the biomechanically ideal posture is. However, that knowledge doesn't seem to help much with preventing such an undesirable adaptation. Then, I suppose we must ask if it is even possible to consciously control our adaptation. Let me talk about research evidence which shows that sensory-driven adaptation is so ingrained in our brain that we may not have conscious control over it. Box A demonstrates typical patterns of adaptation. In this particular study, participants were instructed to reach the green target with the cursor controlled by a hand that was hidden under the table. The hand that was hidden moved the cursor on the monitor, and this represented the location of the sensor attached to their fingers. The sensor was manipulated so that the cursor movement was shifted 30 degrees counterclockwise from the actual movement. As expected, the participant started to miss the target 30 degrees counterclockwise at first. However, as the participants repeated the task many times, they learned to aim 30 degrees clockwise to hit the green target. Now let's talk about box B. The researchers replicated the research shown in box A on other participants. However, this time, the researchers instructed the participants to deliberately aim 30 degrees clockwise to hit the target because the sensor is manipulated. This explicit strategy worked very well at first, and the participants were able to hit the target during the first few trials. However, as they repeated the trials, they started missing the target further and further clockwise. The participants became increasingly frustrated as they had no idea why they kept missing the target. Some even thought that the researchers have lied to them. What was happening? The only explanation was that the sensorimotor adaptation occurred non-intentionally. The same non-intentional adaptation occurred in numerous other studies that utilized different types of adaptation. As a result, it was eventually suggested that motor adaptation is implicit, meaning that it is non-intentional, automatic, and occurs without one's awareness. It was suggested that such an implicit nature of adaptation serves to overcome the limitations of how our central nervous system generates motor commands. Let me talk about that more in detail. A motor command is a selective neuronal discharge from the motor cortex that induces desired kinematic changes of the body, such as the angle of movement, trajectory, distance, or acceleration. The problem is that the neuronal cells within the motor cortex don't necessarily contain information of kinematic profiles of the body. Kinematic changes of the body is merely the result of the summation of the forces that are generated by each activated muscle fibers. This means that our brain decides a motor command based on its estimation on how much force should be generated from each muscle fibers to cause the movement we want to achieve. Such an estimation can be made cognitively, as it is represented as a mathematical equation on the slide. There are variables that affect the kinematic changes of the body given the same amount of force. Examples of such variables are weight and length of the segment to be moved, or flexibility of our soft tissues. We can appreciate that the values of these variables often change as we use different manual tools, such as a tennis racket or a hammer. In addition, growth, development, the aging process, or injuries also often affect changes of these values. If cognition is the only way that we can estimate the required forces for a desired movement, we would have to measure these values every time they change. If so, the process of estimating the required muscle activation would be extremely slow, and it would be impossible to control our movement in a timely and precise manner. Implicit adaptation is one of the ways that the brain overcomes the limitation of delayed cognitive estimation of the kinematic responses of the body. For example, constant calibration and instantaneous updating of motor commands automatically account for the changes of the values of the important variables such as segment length or flexibility of our soft tissues. Importantly, it was also suggested that continuation of the implicit adaptation helps the central nervous system form a neuronal model of task-specific body dynamics that allows us to achieve symbolic understanding of a task. For example, this forehand stroke is such a symbolic action for an experienced tennis player like Roger Federer, meaning that he doesn't have to think about the complex neuromuscular coordination to perform this task. The model of body dynamics is shaped as the neuronal representation within the sensorimotor cortex changes. For example, in vivo studies on primates found that the motor cortex is capable of forming directional preferences within its neuronal cells after repeating a certain task many times. And it was argued that such directional preferences may work like a convenient lookup table for forming synergistic muscle activation. Establishing such a muscle synergy is the key to shaping our variable movement into adaptable patterns. What drives the implicit adaptation then? To find the answer, the researchers replicated the same experiment on reaching adaptation that we talked about several slides ago. But this time, they recruited patients with cerebellar deficits. The result was completely different compared to that of the experiment on a healthy population. Box A shows that the patients failed to achieve typical adaptation without being given an explicit instruction, missing the target counterclockwise throughout the trials. Box B shows that when an explicit instruction was given, the participants reached the target throughout many repetitions. This indicates that they were not able to make the adaptation implicitly, but were able to follow explicit instructions. What are the implications? If we relate this to the mechanism of the internal model, we see that the cerebellum is what recognizes the mismatch between the expected cursor location and the actual cursor position, which is essentially the sensory prediction error. Therefore, the results suggest that the mechanism underlying implicit sensorimotor adaptation is the sensory prediction error. It is clear from the research that a sensory prediction error drives our implicit motor adaptation. There are tools or devices available that can intentionally create sensory prediction errors. For example, there is prism glasses that can shift our visual field to a certain direction. In addition, there is a split belt treadmill that can create asymmetric demands on our gait, and a virtual reality system that creates a discrepancy between perceived and real movement. I think that these tools and devices can be used to improve specific biomechanical patterns of movement. For example, it was anecdotally observed during a study on sensorimotor learning that the hip joints rotated to a certain direction when the participants were required to walk straight while wearing prism glasses. In addition, a group of practitioners have already published a case study that showed that wearing prism glasses while exercising has improved muscular imbalance issues that were not very responsive to exercise alone or manual therapy. We don't always need fancy devices to apply the sensory-motor adaptation to a movement training. In fact, we can find how the sensory-motor adaptation is induced in the movement training methods that we are already using. Let's look at an example of how we are currently helping patients and clients improve their body mechanics. When someone habitually collapses his or her knee medially when loading the body weight onto one leg, we can use a TheraBand that exaggerates that mistake. As a result, the person can reactively correct the misalignment of his or her knee. This method is commonly called the reactive neuromuscular training, and it is not new. Many people already know that this method induces immediate effect of realigning the posture. Then why am I talking about this? It is because such benefit doesn't easily transfer to the movement without the TheraBand. This indicates that immediate improvement is only a temporary adaptation specific to the TheraBand. In response to the TheraBand, the central nervous system somehow came up with the motor commands which are more desirable for controlling the lower extremity. What we really want is for the person to be able to achieve the same motor commands without the TheraBand, as it is more transferable to other contexts. How can we maximize the potential for such a transfer while using the TheraBand for training? Let me talk about a study that gives us an idea for maximizing the transferability of a tool-specific adaptation. In this particular study, participants practiced a reaching movement while holding a mechanical handle. The handle generated forces that pushed a participant's arm in a certain direction that made them miss the target. Eventually, the participants adapted to this force to reach the target. This experiment was performed under two different conditions. One with variable forces, another with a single consistent force. The results showed that the adapted movement was better transferred to the movement without the handle when the adaptation occurred under variable forces rather than under a consistent force. This is because the brain differentiated between internal and external sources that affected movement error. In case of this experiment, internal sources of error was the motor command specific to the arm dynamics, and external sources of error was the dynamics of mechanical handle. When the participants adapted under variable forces, the brain recognized that the motor command specific to the arm dynamics was more predictable sources of error compared to the dynamics of mechanical handle. Based on this, the brain prioritized the implicit adaptation towards a more predictable factor, which was the motor command specific to the arm dynamics. The opposite was true when the participants adapted under a consistent force. Adapting towards more predictable sources of error was necessary for the brain to maximize the chances of hitting the target in the future. Therefore, it can be suggested that using variable resistances rather than using a consistent resistance for corrective exercises would be beneficial if our goal is to developing coordination patterns that are transferable to various contexts. What does the principle of the relationship between adaptation and variability tell us about current corrective exercise strategies? The exercises shown in the slide are often used to reactivate the force couples that allow upward rotation of the scapula. There are usually two aims of these exercises. One is to facilitate the inhibited muscles, and another is to improve the strength endurance of these muscles. Therefore, programming for these exercises should address both goals. However, in most cases, we have designed an exercise program to be suitable more for improving muscular endurance than facilitating the inhibited muscles. For example, it calls for 15 to 20 repetitions with a fixed amount of weight or resistance for 3 or 4 sets until fatigue, which is based on the principles of overloading that induces physiological adaptation of the neuromuscular system. However, taking into account what we now know, we can now appreciate that facilitating inhibited muscle would require a different mechanism than simply physiological adaptation. It requires motor adaptation that allows the brain to update the neural representation of the body dynamics. As we discussed in the previous slide, updating the body dynamics through exercise would require variable rather than consistent external forces or resistance. I suggest that it would be worth considering additional options that can provide more variable resistances than traditional weights or weight plate-based exercise equipment. Manual perturbation, for example, would be an effective way of changing the amount of resistance after each repetition. In addition, a pneumatic or hydraulic resistance system can also provide a convenient way of varying resistance that is also measurable. Up to now, I have been talking about how to guide people to adapt towards desired movement mechanics using tools or equipment. Let me change a gear a bit and talk about verbal instructions and cueing. We often give our clients instructions regarding proper muscle activation or joint positioning, hoping that it would facilitate an adaptation towards correct movement mechanics. However, it is possible that such explicit instructions may not have much control over implicit motor adaptation. In addition, it was suggested that internal cues that draw conscious attention to the internal process of movement, such as muscle activation or joint mechanics, would interfere with the implicit motor control process. It was suggested that it would be more effective to use external cues that draw attention to expected movement outcomes or goals. These suggestions are well supported by the research evidence on motor skill learning of both novice and elite athletes. For example, when practicing a volleyball serve or a golf shot, external cues that directed athletes' attention towards a volleyball or the motion of a golf club yielded much better performance compared to the internal cues that directed their attention to the motion of their own hands or arms. So currently, coaching science is leaning towards using external cues for enhancing motor skills. I've experienced that athletes prefer external cues when I was working as a strength conditioning coach. But I also noticed that external cues don't work well for the exercises used for rehabilitation. Many of the rehabilitation exercises focus on redeveloping motor patterns such as squatting, lunging, and hinging. Interestingly, I noticed that many of the rehab clients actually showed better retention when I used internal cues rather than external cues. The examples of the external cues that I used for squat are sit back into an imaginary chair or push the ground to stand up. Examples of the internal cues are push your hips back, draw your thigh bone into the hip socket, or feel the support from your heels to engage your glute. Some clients even mentioned that the external cues were confusing. They did not feel like they knew which muscles they should use to follow such vague cues. So I had to admit that there are some gray areas regarding the benefit of internal versus external cueing. Let me share how I made a reconciliation between external cues and internal cues. The exercises that are so-called corrective or restorative exercises, which are often used for rehabilitation, aims to redevelop muscular and joint coordination patterns. Connecting sensation of muscle activation and joint proprioception to the movement is important when redeveloping the coordination patterns. An electromyogram study showed that the activation of the engaged muscles increased after hearing the internal cues rather than the external cues. This indicates that internal cues are beneficial for enhancing the awareness of muscular control. As we practice, our coordination patterns would become automatic. Once we achieve the automatic coordination, the goal of movement training naturally changes towards skill development. At this stage, the purpose of movement would be obtaining external goals using the already developed coordination patterns. The examples of the external goals can be landing a tennis ball on a desired location or producing more power to jump higher. At this stage, we would be more naturally attracted to external cues rather than internal cues. Therefore, we can argue that it is important to find out where our clients fit into this performance development spectrum and find the cues that best tune in with what they prioritize. Today, I have talked about the neuroscientific theory of human sensory-motor adaptation. It can be summarized as the following. First, sensory-motor adaptation occurs automatically and unintentionally due to the embedded function of the internal model that reduces sensory prediction error. Therefore, we have minimal cognitive control over it. Second, the central nervous system can differentiate between predictable and unpredictable factors that affect movement based on the variability of each vector experienced. And it prioritizes the adaptation towards less variable sources as these are more predictable. And with respect to applied implications, I would like to suggest the following take-home messages. First, creating sensory prediction errors is an effective way of tapping into the brain's mechanism to induce adaptation towards specific movement patterns. Second, when using external forces to generate motor adaptation, varying the amount of perturbation can maximize the potential to update the body dynamics, body mechanics that are transferable to other contexts. Third, if we need to use verbal instructions or cueing, we should consider where our clients fit into the performance development spectrum and find the cues that best tune in with what they prioritize. To wrap up, I would like to emphasize again that continuing to learn more about motor adaptation and learning is critical for kinesiologists. Many kinesiologists work in rehabilitation settings and help people recover from their injuries. For this reason, some of our work inevitably overlap the role of other health practitioners, such as physiotherapists. However, it would be important to remember that kinesiologists play such an important and unique role beyond rehabilitation services. We not only help people return to their occupational, recreational, and sports activities, but also help them enjoy these activities for a long term. The strength of our work comes from our abilities to efficiently guide people to apply what is gained in the gym or clinic to their daily environments. This is not an easy task if we don't truly understand and appreciate how our nervous system controls our movement while allowing us to interact with a changing environment. I hope that I convinced you that it is important to continue to learn and apply science of motor control to our work. If so, I would like to introduce some useful resources to learn more about sensory motor control. First, Sensory Motor Control and Learning by Dr. James Tresillian is just an amazing book that introduces the behavioral neuroscience of movement in an easily digestible manner. Second, The Motor Control, written by Drs. Marjorie Ullicoat and Shumway Cook, is another great book. The authors in this book not only provide research-based knowledge, but also its application to clinical practices. You will also learn how motor control problems are examined, diagnosed, and treated in clinical settings. Really useful for kinesiologists who work with people with neurological disorders. Proprioception and Neuromuscular Control in Joint Stability is a book written by many sports medicine doctors, surgeons, physiotherapists, and athletic trainers. It is one of the first books that explained how principles of sensory-motor control is applied to neuromuscular rehabilitation of joint-specific injuries. I briefly mentioned about virtual reality system when I was talking about the ways to create sensory modification. Simon Fraser University Pain Studies Group has been studying and developing ways to manage pain through virtual reality system for more than 25 years. I have been collaborating with this group for about a year now. They have so many interesting and insightful projects, and it would be absolutely worth checking their websites out. Here are some other useful resources. And these are the references by subjects. Thank you everyone for listening very patiently. Hope you enjoyed the presentation. You can email me or go to my website if you want the PDF file of this presentation. It is www.embodieddynamics.net with double D's in the middle. I would be also happy to answer any questions if you could email me. Thank you again everyone. Bye for now.